So some of the autologous stem cells, okay, autologous again refers to stem cells that are from your own body. Some of the pros and cons are here on the slide. So one of the pros is it's a well-known source of stem cells. So every single person here has millions or maybe billions of stem cells, you know, floating around throughout your body. That's kind of nice. So, you know, why not harvest those if we need to? There's reduced risk of rejection, reduced risk of inflammation. Again, these are cells that are already in your body. We're just taking them from one place where they're kind of sequestered and putting them into a different place that actually needs them. Then finally, you know, there's reduced potential for transmission of bacteria or virus because you either probably already have that bacteria or virus. It's probably not some third-party bacteria or virus that's going to be introduced because, again, it's coming from your own body. Just to give you a frame of reference, you know, when we're reintroducing your own stem cells, it's happening literally, you know, an hour after you harvest it. So it's happening right away. So it's not, you know, sort of being, you know, locked up for weeks or months somewhere. It's being taken out and put right back in. So some of the cons, it is a surgical procedure. We'll go into a little detail about how the harvesting is done, but ultimately you have to harvest in some way. There's additional capital that's required. There's more disposable equipment. There's surgical equipment. And these are all one-time use things. These are all low-volume, one-time use items, so the cost can be a little higher. There can be some complications, obviously, with any procedure, including any surgical procedure. And sometimes you may have concentrations that may be lower than what you want. This is especially true with the bone marrow aspirations. The bone marrow aspirations are up to 100 times lower in terms of concentrations than the fat aspirations. So the liposuction-derived stem cells are about 100-fold, or even more sometimes, concentrated with stem cells than the bone marrow aspiration. It's for that reason, as well as the fact that most people are more than happy to give up their fat, but they're not so happy to give up their bone marrow, especially when you find out how it's actually done. You literally have to take a huge trocar, a huge boring needle, and smash through the iliac crest, put a hole in the bone, and suck out that bone marrow, potentially lead to fractures in the future and all these other problems just to get that bone marrow. Or I can just suck out your fat. You know, which one would you want, right? So obviously we've done the lipo aspiration for many years, and really, you know, bone marrow aspiration is great. It's been around for longer than lipo aspiration, but at this point, bone marrow aspiration is, in my mind, completely pointless when we have lipo aspiration and when we have some other technologies that we'll talk about. So this is adipose-derived adult stem cells. This is an actual picture from one of our patients, okay, one of our procedures. So you can see here that we're sort of doing the lipo aspiration. It's literally a liposuction. You're just going, you know, beneath the skin at some of the layers of fat that live beneath the skin, and you're sucking it out just like you would with a liposuction. And then you know, you spin it down. You do multiple washes where you're washing out all the fat, you're washing out all the white blood cells, you're trying to wash out all the red blood cells, and so you're just left with pure stem cells. Bone marrow aspiration, on the other hand, you know, you can kind of see a little picture here. You have this guy sort of shoving this needle into a bone, you know, putting a hole in the bone, sucking it out, and then spinning it down, and then again getting stem cells from that. It's been used, you know, bone marrow aspiration again has been used for a long time, and orthopedics have used it for a very long time during their surgeries. So literally right during their surgeries, you know, they'll aspirate some of that bone marrow out, and you know, spin it down right there in a centrifuge, and then just re-inject that right where they're doing surgery, and it helps with some of their outcomes. But again, not as concentrated as the lipo aspirate.